The treatment of patients with dry eye syndrome mainly consists of three key components: replenishing the aqueous part of the tear, stabilizing the tear film, and managing accompanying diseases related to xerosis, both of the eye and the body as a whole. So what does this actually mean in practice? Most often we prescribe medications that either replace or stabilize the patient's own tear film. These are medications based on methyl cellulose, polyvinyl alcohol, and hyaluronic acid. When mixed with the patient's own tears, they form a film-like structure that prevents moisture from evaporating too quickly. All tear substitutes, regardless of their composition, need to be instilled 4 to 6 times a day, because this is replacement therapy, not pathogenetic therapy. These tear substitute medications can also be roughly divided according to their viscosity and concentration. Medications with low and medium viscosity, such as Optinol, Cysteine, Halo-K, and Halokomod. They are suitable for patients with mildly pronounced dry eye syndrome. For those who need something a bit more viscous, there are gel-based medications available, such as Corneregel, Autogel, Vidisic, and Cysteine. They are more viscous and create a denser film on the surface of the eye, which means the tear evaporates even more slowly. Each medication has its own niche. That is, there is now such a huge variety of tear substitutes on the market, and the ophthalmologist selects the medication individually, taking into account the toxicity of the preservatives included in the formulation. There are also preservative-free forms, which are more preferable. Additionally, there are supplementary ingredients in these medications, such as dexpanthenol or hyaluronic acid. For each specific case, there is a particular medication, but again, it is selected very individually, since a patient may have to try several tear substitutes before finding the one that actually helps them. For those patients who do not respond to medication therapy, and such a group does exist, there are surgical treatment methods. Most often this involves occlusion or obstruction of the lacrimal puncta. This is done so that the tear does not drain away, so to speak, through the physiological pathway, but instead remains in the eye cavity a bit longer. There are various types of lacrimal punctal plugs, up to and including permanent suturing of the puncta for patients with more pronounced xerosis, or those who have recurrent corneal ulcers due to this dryness. There are more radical surgical treatment methods, for example, blepharoplasty, but this is reserved for particularly severe cases. It is also important not to forget about etiological therapy, meaning addressing the causes that may have led to dry eye syndrome. For example, if it is due to an allergic reaction, then anti-allergic treatment is indicated. If it is caused by metabolic disorders, then the treatment should correspond to that as well. Similarly, if the problem is related to immune status, then various immunocorrective medications are used. If it is Sjogren's syndrome, then we treat that specifically. In other words, dry eye syndrome is not always an independent condition. It is a set of symptoms that appears against the background of some underlying disease. Accordingly, by treating this underlying disease, we achieve improvement in this particular condition.